Good afternoon, everyone. Thanks for coming to Grand Rounds. Appreciate that you're all here, and really pleased to see so many people in the crowd who are responsible for educational programs here to listen to Dr. Cullen's talk. I'm really pleased to introduce Michael Cullen. He's the Director of Evaluation in the Graduate Medical Education Office here at the University of Minnesota, which is where I do my work. Michael has an interesting background. He's a Canadian guy, so he's got that going for him, and he's also previously worked as a criminal defense attorney. And then after leaving his law practice, he entered the PhD program in industrial and organizational psychology here at the University of Minnesota, and really found his passion there. Michael worked for many years in industry, helping employers design tools for assessment and evaluation. Worked with many large contractors, the Defense Department among them. And then, seeking a new opportunity, responded to a call from our office for someone with expertise in evaluation to assist us in both the evaluation of our programs, but also the evaluation of our learners. He's been working with us now for nearly 2 years and has really achieved some remarkable success, has been a great resource to all of our programs. And I'm pleased to invite him here today to talk to you in general about assessment and evaluation, hopefully give you some frameworks for thinking about that, maybe some new tools, and introduce himself as a resource you might take advantage of further. So without further ado, Michael, I'll turn it over to you.
Okay, thanks very much, John. Can everyone hear me okay in the back, so forth? Okay, wonderful. First of all, welcome. Thanks for coming to spend your lunch here with us. Such a beautiful day. Really appreciate it. Thanks for that introduction, John. So with the advent of the milestones and the next accreditation system, we thought it'd be worthwhile to review some basics of assessment and evaluation. And so for today's talk, I'd like to focus on 4 main things. First of all, what's the purpose of assessment generally? What are the key features of good assessments? What are some tips for choosing different assessment tools? And I'll end with just a brief introduction to the milestones and what they're all about. So in terms of the purpose of assessment, there's really 2 main types. So formative assessments, your key question is, how is the learner progressing on his or her learning in whatever it is that we're trying to teach? And the key thing about formative feedback is that feedback is really an integral part of the assessment process. It has to be. So for instance, the milestones is a good example. According to the ACGME, the key purpose of the milestones is to provide trainees with feedback about their performance on the milestones from beginning to end of their training experience. And so if that's the purpose of the milestones, it has to be an integral part of the assessment process in dealing with milestones to provide trainees with some feedback about how they're doing. And so just as an example of a document that tries to do that, in your handout or packet of materials, there's a resident fellow milestone feedback sheet that we've put together at our GME office. And just very briefly, this feedback document it's for use. It was intended for use with program directors in providing that twice yearly feedback to trainees, but it really could be used by any leaders within PEDS and elsewhere. So as you can see on this document, there are several sections to the feedback document. There's a previous action plan, which focuses on which milestones might have been targeted for improvement in the past and what progress has been made so far. There's a section for current strengths, so an area to provide very specific details about the strengths of a trainee on specific milestones and behaviors. There's an area for developmental opportunities. So what is it this trainee can do in the future to specifically address any skill deficits? And then there's an action plan. And I guess the point I want to make about this document is it really involves the input of not only the program director or faculty member, but also the trainee. And so on the sheet, you would have a faculty member fill out the white portions, the trainee fills out the gray portions, and then together on the yellow portions, the trainee and faculty member would come up with a plan for addressing any skill deficits or developing specific behaviors. So I just wanted to provide that as an example of how to incorporate feedback into the assessment process for a formative type of assessment. So a summative assessment, in contrast, is primarily interested in whether someone has mastered a set of knowledges or skills or behaviors. So for instance, if you think back to high school, you're taking a calculus course or a math course. The end of course assessment is trying to assess your mastery of that material in the course. Same thing with courses you might have taken at med school or elsewhere. But in either case, whether or not it's formative or summative assessment you're concerned with, your purpose is always really to try to assess the degree to which your learner has acquired either knowledge, skill, or behavior. And in some rare cases, you might be assessing some affective states or some emotional states of the trainee as well. So what do I mean when I say that you're trying to assess knowledge, skills, behaviors, or affective states? The key point I want to make is that these are all very different outcomes. So for instance, if you take teamwork as an example, you might be interested in assessing whether somebody has knowledge of teamwork principles. That would be assessing knowledge. In contrast, you might be interested in assessing whether someone can actually be a good team player. In that case, you're assessing their skill in teamwork. In contrast to that, you may be interested in rotations, are they demonstrating specific teamwork behaviors, regardless of their knowledge of teamwork or their actual ability to be an effective team player? Are they demonstrating those skills, those behaviors in rotations? And then occasionally, you'll be interested in the thoughts or feelings or perceptions of your trainees with respect to a given outcome. And so again, the purpose of kind of splitting out these outcomes is just to drive home the fact that they're all distinct, and they have to be measured distinctly. So as an illustration, you can also think of sort of learning how to play golf, right? If your interest is in knowing whether or not somebody knows the rules of golf, you're going to be assessing knowledge. You wouldn't take them to the driving range to see whether or not they knew the rules of golf. And also, if you're interested in knowing whether someone can drive the golf ball, you're not going to give them a knowledge test. You're going to take them to the driving range. So what you're trying to measure can break down into these different categories, but they're all very different from each other. So in terms of features of good assessments, one key introductory point is that assessments should be thought of as samples of behavior for a relevant domain. So it's impossible to assess the entire domain of knowledge or skill or behavior that you're interested in. But for it to be a fair assessment, you want that to be a representative sample of that domain, right? So if you think back to your college courses in math, for instance, you probably didn't get asked every possible question the professor could have asked for that math course. But hopefully, if it was a fair test, the professor representatively sampled from the different areas that he or she was trying to teach. That would make it fair. So assessments are useful for decision making when they possess three basic characteristics. First, they should be reliable. Second, they should be valid. And third, as I mentioned, they should adequately sample the domain that they're trying to sample. So what do I mean by reliability? So there's two basic types of reliability. First, there's something called internal consistency reliability. That has to do with whether or not the items on an assessment intercorrelate with each other. And so to the degree that items on an assessment are highly intercorrelated, we can draw the conclusion that those items are measuring a unitary construct. So that's a good thing. But then there's stability reliability as well. That's the question of whether or not your scores on that assessment at one point in time will be very similar to your scores on that assessment at another point in time, absent any learning in between. So for instance, if I step on a scale in a physician's office and it says 148 pounds, and I step off it again, when I step back on it, I would hope it measures 148 pounds again and not 184 pounds, something like that. That would be an unreliable measuring instrument. In the same way that you want that to be true for your scale in the doctor's office, you want it to be true for your measuring instrument as well. So you can look for evidence of that when you're considering which assessment to use. So if an assessment is reliable, it means we're measuring something, but we still really have no idea what it is we're measuring. So the question of what we're measuring is the question of validity. So in general, assessments are valid if we have some evidence that it makes decisions more accurate. And assessment validation is really, in general, the process of determining whether that's true. So there's really three categories of validity evidence you'd want to investigate to assess the validity of any assessment tool. The first would be empirical validation evidence. That's the question of, do scores on my assessment predict a relevant outcome? What's considered a relevant outcome is a separate question, but to the extent that your assessment predicts that relevant outcome, you would have some empirical validation for that assessment. Second source of validity evidence is content validation. So you want to have some evidence that your content is representatively sampling the domain you're interested in. And then finally, with construct validation, this is the question, well, what evidence do we have that we're actually measuring the construct or the trait that we think we're measuring, that we're interested in measuring? So in an ideal universe, you would have evidence of all three of these things before you said that an assessment is valid. You usually don't have all of that evidence, but to the extent possible, you're trying to look for evidence of these things. So let's start with empirical validation. The most common form of empirical validation is predictive validity. So as an example, do scores on your assessment predict a relevant outcome? As an example, do MCAT scores predict grades in medical school? Do MCAT scores predict clinical performance in residency? Just raising those two possibilities highlights an important point. You might have predictive validity for your assessment for one outcome, but not for another. So let me just ask, why might be a reason that the MCAT would be a good predictor of grades in medical school, but not such a great predictor of clinical performance in residency? Any ideas? Exactly. So the MCAT is a measure of a subset of medical and other scientific knowledge. It's likely to be a good predictor of knowledge tests in medical school. But when you step into residency, you're now asked to translate that knowledge into behavioral action, into skill. And so a knowledge test may not necessarily be a good predictor of your ability to skillfully put that knowledge into action. So in that case, we'd have predictive validity for the MCAT in terms of grades in medical school, but it would not be a predictive measure of residency performance. So this is just a graphical depiction of what we just discussed. Your assessment will be predictively valid for a given criteria to the extent that higher scores in that assessment are associated with higher scores on your criterion of interest, and lower scores are associated with lower scores on your criterion of interest. So a lot of times people ask the question, well, how significant does the correlation need to be for it to be important? And the answer to that, quite frankly, is it depends. So in many cases, a modest correlation between your assessment and a criterion will be important. And in other cases, a high correlation between your assessment and the criterion may be unimportant. So what would be an example of a situation where a correlation between your assessment and a criterion is low, but still important, sort of scientifically? Any thoughts? So as an example, let's say you had knowledge that having a particular nutritional supplement had a modest correlation with preventing a very serious disease. that might be a criterion, that might be a relationship that's worth knowing about. Even though it's a modest correlation, if it has some predictive capacity for a very bad outcome, it's worth knowing about, perhaps. On the other hand, some high correlations are trivial and not interesting at all. So if it's a rainy day outside, there's going to be a high correlation between the number of people that are carrying umbrellas and wearing raincoats. It's going to be a very high correlation, but it's not particularly important for any scientific or other purpose. So it depends. So the question of the importance of the size of the correlation depends on the domain you're talking about. By the way, that last example between raincoats and umbrellas is a good example of why correlation is not causation, right? There's a high correlation between the number of people carrying umbrellas and wearing raincoats, and yet causation is a third variable. It's raining. So content validation, again, is this question of whether or not your sample of behaviors, your sample of knowledge, your sample of skills for the domain you're trying to measure is a representative sample of that domain. So again, going back to your courses in high school or college, just take math because it's an easy example. You want the end of course evaluation to be, it will only be fair really in anybody's eyes if it's a representative section of the entire domain. So again, in your packet is an example, just kind of bringing it home to pediatrics for a moment. Again, in your packet is an example of one of the milestones, systems-based practice 1, and it's called Coordinate Patient Care Within the Healthcare System Relevant to Their Clinical Specialty. And so as I look at this set of behaviors in this milestone, I see immediately that it's multidimensional, right, in terms of the behaviors that it's trying to assess. So I'm just looking at level 4. Actively assist families in navigating the complex healthcare system. Has open communication, facilitating trust. Routinely makes a written care plan. Makes a thorough care plan, etc. There's several behaviors that are trying to be assessed within this even very narrow domain of systems-based practice. For your assessment to be content valid, it should sample behaviors from all relevant dimensions within that domain. To the extent that it does so, it's content valid. To the extent that it fails to do so, it's not, and would probably be viewed as an unfair exam or assessment. So a separate problem is, so this is exactly what we just talked about, poor sampling. So if, for instance, you had an assessment that just measured one of the behaviors in SBP1, but not all of them, we'd call that an effort at poor sampling. It would not be a content valid assessment. But a separate problem is contamination. So let's say you're interested in measuring teamwork knowledge and skill, but your assessment, in addition to measuring those things, also measures something completely different. Just to make the point stark, what if it also measured cognitive ability or something completely separate from teamwork? To the extent that your assessment measures not only what you're interested in, but other domains, it would be a contaminated sample. Again, it wouldn't be a fair assessment. So it's important when you're considering your assessments to use that it be representatively sample that domain and then it be focused only on that domain. So this is an actual end of rotation assessment from a program that will remain unnamed that purports to measure medical knowledge and patient care at the end of that rotation. So thinking about what we've discussed in terms of content validation, what are some ways that this can be improved as an assessment, an end of rotation assessment? What's missing from it, for instance? Any ideas? Well, one thing is that it doesn't really articulate what's meant by medical knowledge and patient care in any degree of detail. It's a very general statement, right? Possesses medical knowledge and patient care. Yes, there are a few general examples in brackets, but it doesn't really articulate the different domains of medical knowledge and patient care at all. And why is this a problem? Well, if we think back to the notion of milestones being a formative assessment whose primary goal is to give trainees feedback on their performance on those milestones, how useful is this assessment going to be for feedback purposes to a trainee? When you see that you're either needing improvement or you're competent for your level of training, and that's the end of the information you get about that milestone, how useful is that feedback to you when you go back to try to improve behaviors? It's not very useful. And so here's a better example from a different program. It's also an end of rotation assessment. But you can see in this case, the specific elements of behavior, in this case knowledge, are very specifically outlined for the domain. So this is very helpful to a trainee when they get this back or they see these results. They'll know specifically which behaviors or which knowledge sets to work on in the future. So this would be a much more content-valid assessment of medical knowledge and much more useful to the trainee. So apart from representativeness of the sample and empirical validation, what else are you interested in with your assessment tool? You want to try to make sure that it's assessing the construct or the trait that you're interested in measuring. So one source of evidence that your assessment is doing that is something called convergent validity. So let's say, once again, I'm interested in measuring teamwork skill of trainees. My assessment would have convergent validity to the extent that it correlated highly with other measures of teamwork skill in the literature. So if it correlates highly with measures of teamwork skill, it has convergent validity. That's one piece of evidence that we're measuring what we're trying to measure. Another piece of evidence is that it has discriminant validity. So to go back to an earlier example, we would expect our teamwork measure to have absolutely no correlation with your proficiency in calculus, right? If we gave people a whole set of teamwork measures and calculus exams, and there was high correlations between all of them, we'd start to wonder if we were missing something in how we were measuring teamwork. So it should also not correlate with measures that have nothing to do with the construct you're interested in. That would be evidence of discriminant validity. In certain cases, there's construct validation evidence coming from the differentiation of scores on your test between experts and novices. So for instance, let's say you're a teenager taking a driving exam. We probably wouldn't think it was a very good exam if everyone who hadn't driven before, if pure novices passed that exam on the one hand, but on the other, people who have been driving for 20 or 30 years failed that exam. That would be evidence that there's something wrong with our test, our assessment. To the extent that that exam sorts people into the correct groups, that's another source of evidence of construct validity for your assessment. It's not often detailed in reports of an assessment, but it's a useful one. So I'd like to change tacks for a moment here and get to the question of, well, how do you choose between all these different assessment tools that you've got? So in the next accreditation system, you've got potentially, depending on your program, a lot of very different types of tools to choose between to assess your trainees, right? You've got self-evaluations, faculty rotation evaluations, you've got OSCE performance perhaps, or you've got 360-degree evaluations from all sorts of different perspectives. How are you going to choose your assessment tools? So the key in choosing your assessment tools is really to make sure there's an alignment between what it is you're trying to teach and then how you measure what you're trying to teach. And it's really easiest to do in thinking about your learning outcomes and your assessment methods. It's easy to align those two things. So if you're trying to measure knowledge, you're going to have some type of knowledge test. If you're trying to measure skill, you're going to have some type of skill-based measure. But what becomes trickier is how to align the instructional methods. So it, for instance, may be an open question whether a lecture method versus some sort of discussion method versus some simulation method may be the best way of teaching any particular knowledge or skill or behavior. That's more of an open question. But in general, what you're trying to assess gives you a lot of information about what the best method is. So if you look at this Miller's Pyramid of Clinical Competence, it gives you a bit of a breakdown of some of the best assessment methods given your original objective and what you're trying to teach. So again, if you're trying to teach knowledge, then written exams, oral exams, that type of thing are going to be a useful method for assessing those things. On the other hand, if you're interested in assessing somebody's skill and actually performing a behavior, it's probably not going to be to your advantage to give them a knowledge test. You're going to have to test their skill ability. And the way to test skill usually involves them performing that skill in some manner. So it could be through simulation. It could be through actual observation of their behaviors. It could be an OSCE. It could be several of these different measures which get at the assessment of the skill itself. On the other hand, you may be interested in measuring someone's behaviors on the job. Did they actually perform the behaviors we're interested in? And one of the best tools for doing that is a 360-degree evaluation. So just very basically, that's just an evaluation from several different stakeholders who are able to observe your behavior in a performance domain. So for a trainee, it might be faculty members, other trainees, attendings, all giving ratings on whether or not a trainee is performing the behaviors that we expect them to perform in a domain. To break it down even more, depending on whether you're measuring knowledge, skills, behaviors, or affective states, you can get into both subjective and objective assessments. You can break it down by the individual, team, or organizational level. So in most cases in residency settings, you're interested in how the individual is doing. And so you'll be focused on that first row of measuring individual respondents' knowledge or skill. But in some cases, you are more interested in how the team is functioning or how the organization as a whole is functioning. So in the GME office, for instance, we're interested in how all our programs are faring overall. So we would be looking at some of those measures at the organizational level to try to determine how our programs are performing rather than the individuals. So occasionally, maybe more than occasionally, you'll want to know whether or not your course or your didactic session or your learning event had the desired effect. Did people learn anything as a result of what you did or tried to teach them? And in terms of evaluating whether your intervention had an effect, there's really just a pretty simple three-step process to that. The first is that you would want to try to assess their level of knowledge or skill prior to your teaching event. Next, you would have your instruction. And finally, you would probably use the exact same tools to measure that knowledge or skill at the end of the course. So it's really a pre-test, post-test design. And using a very simple statistical procedure like paired level t-tests, you can tell whether or not knowledge scores increased from beginning to end of your course or skill-based scores increased over the course of instruction or so forth. That's just a simple paradigm for evaluating whether what you did made a difference in terms of learning. But sometimes the question is, how do I compare whether one instructional method is superior to another method in bringing about a certain outcome? So for instance, I gave a similar talk in psychiatry, and so this example is from that setting. Let's say you're interested in investigating what improves mood generally in people. And your hypothesis is that meditation-based mindfulness intervention is going to be superior for improving mood in both the short term and the long term to a traditional CBT intervention or some other psychiatric intervention. So this is where random assignment becomes crucial when you're trying to figure out if one method is a better method than the other. You would have to randomly assign your trainees to one of the two groups. You would give them, to the extent possible, the same instruction using those different methods. And then you would give them both the same sets of assessments at the end. And then using a slightly different procedure of independent samples t-tests, you could test which group had better outcomes on your measures to see which training method was superior. Okay, so I'd like to talk just a little bit about the milestones. I've talked a little bit about them already. They're developed by the ACGME, program directors with input from trainees and specialty boards. And they're the elaboration of the 6 core competencies you all know very well. Again, their primary purpose is to help trainees by documenting their performance from the beginning of training to the end. The primary purpose is really to give them informative, specific feedback about how they're doing on the milestones. The more specific the feedback you can give them, the more they'll appreciate it, and the easier it will be for them to improve in specific areas. Not every resident is going to progress at the same pace, and so you may have some trainees, some interns who are doing quite well in certain domains and not in others, and vice versa. So here's an example of what we'll call a general competency, systems-based practice 1. I just want to give you an orientation to the different parts of the milestones. The subcompetency is the title of this general competency. So works effectively with an interprofessional team would be the subcompetency. You'll see that there's 5 different levels for this competency, ranging from critical deficiencies to aspirational levels. The milestone itself is really best to think of as a specific behavior. It's really just a behavior that the trainee can engage in. So actively engaging in team meetings and collaborative decision-making. That's one specific behavior in this general competency. If a trainee demonstrates that level for this competency, you would say he's achieved competency in that specific milestone or behavior. Again, the developmental progression is not supposed to be linked to training levels. So it's not the case where all interns are supposed to get 1s, second year 2, third year 3. It really is just based on your particular individual level of competence in the given domain, regardless of your level of class, regardless of your class level or training level. So it's supposed to be completely devoid of that. And in making the ratings, the idea is just to focus on the behaviors that you've observed in that trainee, or you have evidence concerning from your other tools that you're using. This last level, the ACGME calls kind of an aspirational level, which may not be achieved by graduating residents or faculty, but they put it at the end as something to aspire to. So the documentation of resident performance takes place on this bottom grid. And when you look at these checkboxes along the bottom, when you've got kind of this checkbox in the middle of these levels, that indicates that the trainee has met some, but not all of the expectations of the more advanced milestone. So if you gave the trainee a check where this purple circle is, that would indicate they have some of the behaviors in ready for unsupervised practice, but not all of them. So they get the check in the middle. If you put the check in the middle of the column where it says ready for unsupervised practice, you're affirming that they have all of those behaviors at that level and below. So the question does arise, well, why use milestones at all? There are some challenges to using the milestones. I think the key challenge from my perspective as the director of evaluation is seeing how many different types of tools programs are trying to use to get a handle on a trainee's level of a given milestone. And so aggregating scores from different sources, like from rotation assessments or simulations or OSCEs, trying to somehow manage all of that data to come up with a single score is an incredible challenge, I think. But on the benefit side of the equation, it's really all about feedback, right, for the trainees. So to the extent that these milestones are a step in the right direction in terms of articulating the behaviors we care about for trainees, then I think it's an important benefit of the milestones. It's certainly easier to give feedback to trainees about specific milestones when they're articulated in a thoughtful fashion, so that's helpful. You can identify which specific behaviors the trainee needs remediation on because they're outlined pretty specifically. And it's an opportunity to evaluate how your program quality is doing overall. Are you finding that none of your trainees are making it to level 4? And if so, what are the implications of that for your program, and what can be done to try to rectify that? Again, there's some challenges. There certainly needs to be some faculty education in what the milestones are, how to use them for rotation-based rating and overall rating in the CCCs. It can be difficult to rate trainees sort of on the critical deficiency end of the scale. Certainly, especially when physicians are used to getting A's in everything. We're doing really well in everything. Giving feedback that you're not quite an expert yet can be difficult for people who are used to being the expert. And yet it's crucial to be honest in your feedback. You want to be honest about where they really are, but also deliver the message it's not bad that you're in the middle. That's still quite good, and there's things for you to improve. There's things for all of us to improve. So I guess the key points to take away from the talk today is that try to think of assessments as being aligned with your instructional objective. You can go back to Miller's pyramid to get a sense of which methods align with your objective. To the extent possible, it's great to use multiple methods to try to assess your trainees. So instead of just relying on end of rotation assessments, if you have other tools that are useful for a particular milestone, like a simulation-based measure or something else, try to incorporate it if you can. Try to look for assessment tools that have established validity and reliability. So your society should be able to help point you to those tools, I would hope. Training is a really key point, right? For these milestones or for any assessments to work, there has to be some time dedicated to training your faculty on how to use those methods. Without the training, there won't be a shared mental model, right, of how to assess the trainees. And without that shared mental model, you're not going to have much agreement between raters on what they're supposed to be rating. So although it's time intensive, providing some basic instruction that orients trainers to what they're rating, I think is very important. And then again, especially for anything to do with the milestones, giving adequate, timely, and meaningful feedback to learners is absolutely key. They'll really appreciate it, and they'll know exactly what to focus on in the future. So in your handout, there's a glossary of some key assessment terms that my colleague Connie Schmitz and I put together in a recent paper we wrote that's on the National Center for Interprofessional Practice and Education website there. I encourage you to take a look at that paper. It runs over a lot of the same material I've discussed today in more detail. And the glossary will give some brief definitions of some important assessment terms. That's all I've got. Any questions about anything I've discussed today? Yeah. John Andrews.
Michael, that was great. I wonder if you could talk a little more
I wonder if you could talk a little more about construct validity. And what I'm speaking of specifically is the big blue circle you showed that had the little pink dot in the lower left-hand corner, which was representative of sort of incomplete sampling of things related to the domain you're trying to measure.
Sure.
Yeah, that one exactly.
Yep.
And so it seems to me that we're often trying to measure large things. I mean, you could say maybe what you're trying to measure is someone a good doctor.
Yeah.
And there's probably no assessment tool that encompasses everything that goes into being a good doctor. But even sort of more proximate to that, displays appropriate teamwork. Maybe that's the thing.
Sure.
And then our assessment tools are often assessing only components of that. So within teamwork, you might have an assessment tool that says, I don't know, forms constructive relationships with nurses or something like that, which is only a part of it. It's it's that little circle.
Yes.
And I'm wondering how sampling sort of using multiple different approaches to assessment sort of fills that in from the standpoint of construct validity, or whether you really have to have tools that match exactly what it is you're trying to sample. Does that make sense?
I think so, yeah. So one of the key questions in any assessment is sort of how narrow your assessment should be, how tailored to very narrow specific set of behaviors, or how broad. So some people are lumpers and like to bring those behaviors together into a smaller construct, and some, or a bigger one, and some like to be more narrow in their investigation of the construct. I think the milestones are really an effort to try to get the right level of construct to measure. So I think an assessment ideally would be tailored at at the subcompetency level, where there's maybe 3 or 4 behaviors associated with that subcompetency, but not a lot more, not a lot less either. But to the degree that you can use multiple methods of assessing any small set of behaviors, I think you're going to get a more reliable estimate of what that trainee's true level of that knowledge or skill is. So even for something like SBP1 in your packet, certainly end of rotation faculty observations of these would be key. Your question gets at, is there additional utility to using other methods to measure something as narrow as that as well? I think there can be, especially if it's a skill-based subcompetency for which a relevant simulation exists. So I think it's a practical question too, is do other relevant assessments exist which will add value given what you're trying to measure?
And the other practical aspect of that is not wanting to incite evaluation fatigue, where you're asking people to evaluate so many different things that they don't want to evaluate anything.
Exactly. Yeah. Any other questions?
Hi. Can you talk maybe about aspects of being a good physician or being a good resident that are particularly resistant to assessment, either valid or reliable assessment, and maybe some workarounds for those kinds of examples?
Yeah. So frankly, that's one of the reasons that John Andrews brought me into this position, was to try to work at some common assessments for areas that are a little harder to measure. And they tend to be in the interpersonal domain. So interpersonal skills, teamwork skills, professionalism, practice-based learning. These are a little harder to come up with assessments for because they usually involve the evaluation of skills, right, which can vary from one environment to the next. So for something like professionalism, we try to develop this 360-degree tool that assesses a variety of professionalism behaviors on rotations. The challenge in getting programs to use that is it's a little bit longer tool than what they're used to. And so it's kind of a delicate balance. You want to make sure you're representing the domain for something like professionalism, but when it becomes too long, there's evaluation fatigue. For something like interpersonal skills, we're developing, we have 2 measures under development. One are some structured interviews, which some of our residency programs are using to assess traits like conscientiousness, stress tolerance, adaptability in applicants to programs. So the questions are designed to assess They ask about, tell me about a time in the past when you had to deal with a specific situation that relates to the construct you're trying to measure. And then we get scores on those different dimensions like conscientiousness and stress tolerance that can go into the decision-making package for an applicant. But it takes time to use those tools, right? It's a challenge to train the faculty on how to use those questions. It requires accumulating all the data on the back end and analyzing it too, so it's a challenge. Another measure we're going to try to come up with to measure interpersonal skills, something called the situational judgment test. We're in the middle of developing that right now. That's going to present trainees with common professionalism situations that they're likely to face as a trainee, and a bunch of possible responses to those situations, which they'll then rate in terms of their level of effectiveness. And their scores will be compared to kind of some expert scores and how they would respond to those different situations. We'll be able to give trainees feedback on those different professionalism situations. So that's a long answer, but I really want to point out when you're trying to measure some of these interpersonal domains, it does take more resources and takes more investment by the faculty than just the normal end of rotation observation.
With respect to the milestones, the ACGME has put a huge amount of effort into developing these, and it sort of makes empiric sense that providing more feedback will lead to better training for physicians. But I don't know that, I mean, is there a way of knowing that that's actually true, or does the ACGME have a plan in place so a few years down the road they will look back and ask, has this actually led to improved training? Is that something that can be measured?
Yeah. Well, I think what they're trying to do at the moment is simply track how different programs are rating trainees in the CCC. And they're looking at, charts by class level for different programs to see that there's the expected increase in scores on the milestones from one year to the next. But that doesn't really answer the question I think you're asking, which is how do we know that giving increased levels of feedback is going to make for a better physician? I'm not sure they've got a plan in place to do that, partly because it's hard to know how much feedback different programs are giving their trainees. It's going to vary a lot from one program to the next, so it'd be hard for them to track the effectiveness. I think it'd be a wonderful project to try to see whether or not it's true that giving a lot of specific feedback about the milestones would lead to better clinical outcomes, for instance. It'd be a wonderful project. I don't know that anyone's investigating that at the moment. Any other questions? Thank you very much for your time. Yeah.
I'm not sure I really, what I have to be honest about, I'm not sure I really understand. So, the central question is, are we measuring? Right, exactly. And so